Hi, it's Dr. Gregory Morris, podiatrist at Queens Medical Center here in Honolulu, and also co-founder of the Ultimate Foot Store. Today I'm going to discuss a very common foot problem we call Morton's neuroma. So what Morton's neuroma is, it's a pinched nerve in the ball of the foot. So here's a model of our foot. I always like to do show and tell on the skeleton here. So these are your toes, and behind our toes we have these bones called metatarsal bones. And what happens is between our metatarsal bones runs a vein, an artery, and a nerve. And most commonly, the Morton's neuroma occurs between the third and the fourth toes, although it does occur frequently between the second and third toes. Not very common between the first and second or the fourth and fifth toes because there's a bigger gap between those bones. So what happens is very similar to carpal tunnel syndrome, is the nerve gets pinched between the metatarsal bones. And what happens is there's a little ligament, just like this spring between the metatarsal bones, where that nerve becomes slightly entrapped. And especially with prolonged activity on our feet. So once again, right now people are training for the marathon. If they're running more, after you start doing 5, 6, 8, 10 miles, that motion back and forth irritates that nerve and irritates that ligament right there. So basically the nerve becomes inflamed. As that nerve becomes inflamed and swollen, well then a lot of times you get numbness or tingling to the third and fourth toes or the second and third toe if it's occurring there. But also then some people feel like it's a lump. People feel, oh, they got to take their shoe off and also massage their foot. They feel like there's a lump on the bottom of the foot. And as you aggravate that nerve, it becomes larger and larger. As that nerve becomes larger, well, it gets more pinched. And then the symptoms become more frequent and becoming increasingly painful. So at first you can have numbness or tingling, and then later you get sharp shooting pain. I feel like somebody's stabbing their foot. And then if you keep on aggravating, it's there all the time. So it's very important to catch these early on because early prompt treatment can let that nerve calm back down and then not require any additional treatment. So the first step is not aggravating that nerve. So you got to figure out, oh, if I'm running more than 5 miles, what's aggravating it? Well, then try and decrease your running or split it out so you're not running so much time and pounding that nerve over and over again. Other times, if you're on your feet all day long, it's like keep on trying to make modifications to your activities which are aggravating that nerve. Very commonly, the neuroma, I have a neuroma, and it acts up when I'm walking around the house barefoot too much or staying on concrete. I used to coach my kids. And staying on the hard concrete in the pool, my foot become aggravated. So I started wearing shoes, and I started wearing Hoka walking shoes or Hoka running shoes. Because what they do, they provide a lot of extra support and cushioning to the ball of the foot. And taking pressure off of that area. We want to basically cushion the foot and take pressure off the ball, the area where that nerve is being pinched. We also, for neuromas especially, we got to watch out for shoes being tight and squeezing those feet together. And so, women especially, be wary of tight shoes. The worst shoe for a neuroma is wearing a pair of pumps because when you wear a pair of pumps, it shifts the weight to the ball of the foot because of the heel of the pump, and then your foot's being squished together from the tightness of the front of the pump. Luckily here in Hawaii, we don't wear much pumps, but still, any kind of tight shoe, especially in the ball of the foot, can aggravate a neuroma. So making sure the toe box of the shoe is nice and wide, and then wearing a nice supportive shoe, once again, cushioning and support, something that's a little stiffer so you decrease that motion across the metatarsal phalangeal joints so you don't irritate that nerve. That's the first step. And then no matter how good a shoe is, it typically comes with this cheap little liner. It doesn't do much inside of our foot, inside of our shoe. It doesn't support our foot very much. So wearing a better arch support. At the Ultimate Foot Store, we have a nice selection of arch supports for under $50 that work very well at supporting our feet for all different types of foot problems, especially for neuromas. By supporting the arch, it takes pressure off the ball of the foot. So you want a little bit of arch support and then a little additional cushioning. This padding is much better than what comes in our shoe naturally. And at the Ultimate Foot Store, we have 2 types of arch supports. We have regular arch supports. We also have one with a metatarsal pad. So oftentimes when you have a neuroma, wearing an arch support with what we call a metatarsal pad built in can take pressure off of the area of the ball of the foot. So that's why you go to the Ultimate Foot Store. You can step on our computer, but then more importantly, try on a pair of shoes and then try different arch supports and see if that alleviates the neuroma pain by supporting the arch, cushioning the ball of the foot, and possibly putting a little metatarsal pad here to take pressure off the ball of the foot. Once again, here in Hawaii, we don't wear shoes all the time. So when you're not wearing your good shoes or arch supports, then wearing a good pair of supportive sandals. So our Ultimate Foot Store Relief slippers and sandals, once again, provide good cushioning, good support, have a little extra arch support and a little bit of thickness across your little rocker bottom, which alleviates pressure on the ball of the foot. So once again, when you have this neuroma, when you walk, it's cushioning it and taking pressure off the ball of the foot and not aggravating that neuroma. So around the house or when you're standing or walking not in shoes, then wearing a nice supportive sandal such as the Ultimate Foot Store Leaf Slipper. And then over time, if you're not aggravating that nerve, the symptoms will calm down. That nerve will basically not be so swollen and it'll shrink up over time. Nerve tissue takes a long time to calm down. So it might take a month or 2 months. So when you try the shoes at first, it's like, well, it hasn't gone away. Well, it might take a month or 2 months of wearing good shoes and support, not overdoing it on the ball of the foot, for that nerve to slowly calm down. You can do gentle massage, you can take Motrin or Advil. What actually works the best for neuroma, if it's getting more symptomatic, more painful, is getting a cortisone injection. And what cortisone injections do, you give a shot to the top of the foot and it'll help calm that little nerve down. And sometimes one shot will shrink that nerve back to its original size and your symptoms are gone. Especially if you're wearing good shoes and support, you're not aggravating it. Once it calms down with one injection, then hopefully that nerve will go away. If 6 weeks go by and it's maybe 50% better, then sometimes we'll give a second injection, try and shrink that nerve all the way back to its original size. After 2 or 3 injections, after wearing good shoes and support, if that nerve becomes increasingly painful, it's not responding to conservative care, then we often do surgery where we actually either remove that little nerve or simply do what we call neurolysis or decompression, where we cut around the nerve, cut the ligaments to allow for more room for that nerve so it's not being pinched anymore. So once again, this is Dr. Gregory Morris discussing a very common nerve problem to the ball of the foot called Morton's neuroma, which is basically a pinched nerve up in the ball of the foot, typically between the 3rd and the 4th metatarsal heads, but also between the 2nd and 3rd metatarsals. And it's caused by different reasons. Going barefoot on the hard floors can cause it. Wearing tight shoes can cause it. Extended periods of time on our feet, whether training, exercising extensively, especially for the marathon, or working a job where you're on your feet 6, 8, 10, 12 hours a day. Those can all cause a neuroma to occur. If it does, once again, trying a more supportive and cushioned shoe, trying an arch support, possibly with a metatarsal pad, and then wearing a good pair of slippers or sandals, especially in the house, when you're walking on the hard floors barefoot, that can really aggravate that nerve. So once again, this is Dr. Gregory Morris discussing Morton's neuroma for talking feet from the Ultimate Foot Store. Stay tuned for our next episode in the near future about falling arches. It's also called posterior tibial tendon dysfunction, which is basically a stress along the arch of foot causing the tendons to stretch out over time. Especially here in Hawaii, we go barefoot a lot, and so it's very common to develop a falling arch. So stay tuned for that episode, and we'll discuss more of it in the future. Thank you.